This is a Defocus Media production.
Audio Jungle.
What's up, everyone? It's your favorite optometrist, Dr. Darryl Glover.
And I'm Dr. Jennifer Lyerly, resident optometry nerd.
And welcome to Defocus Media, optometry's #1 podcast, where we discuss the hottest topics, latest technology, eyewear, practice management, and more. So sit back, relax, and defocus. What's going on, Jen? How are you doing today?
I'm doing good. You know, it's one of those end of a long day, but I'm excited to talk with you guys this evening because, it sounds like from the topic, you probably aren't thinking like, oh my gosh, after a long day in the office, I'd love to talk about HIPAA, but it is something that we need to talk about. And we're going to make this a very interesting, very engaging conversation because we have an expert that has built an entire career off a platform about HIPAA and making it, I hate to say this because I know this is going to make me sound like so nerdy, but I use your product in my private practice and I enjoy the videos. Like, I think they're very well done and they're kind of fun. Can HIPAA be fun? If the answer is yes, then this is true.
I don't know. We do our best, but I appreciate that. It's a great compliment. We try to make it interesting.
Yeah, and Jim, before we introduce our amazing guest for the evening, when it comes to HIPAA, I'm always running the opposite way. But, when it comes to COVID-19 and everything changing it with the landscape of optometry, I think this is the best time more than ever to really have this conversation and really dive deep into this and really just break it down, because there may be some issues with some practices out there that could get some heavy fines. And I don't want any of my fellow optometrists or eye care professionals to run into any issues where they got to spend a lot of money for no reason,
Yes, absolutely. You're absolutely right.
So Matt, I don't want to like lay the topic down as like, let's scare everybody, but like how serious do optometrists need to be taking HIPAA? Because I think, like you said, Darryl, many of us kind of overlook this and just assume like, oh, I'm probably complying.
Yeah, no, it's a great question. And to go off of what you're saying, it's very important. It's more important now than ever. And so, there's a lot that goes into HIPAA compliance. We bring our booths to the shows and we see Dr. Glover's running the other way. We want to come up and talk HIPAA. But we're trying to flip that. We're trying to make it approachable. We're trying to have conversations like we're having tonight, which I think is great. And they need to take it very seriously. HIPAA sits right at the intersection of healthcare and technology, right? And I think we all understand, healthcare and technology, they're married. They're not going to be separated anytime soon. Technology is being infiltrated into the healthcare industry at an unprecedented rate. And so it's something that needs to be paid attention to sooner rather than later. And what most practices, most physicians don't understand is that HIPAA is actually a permissive law. It can be big, bad, and scary, the enforcement and the fines and all of that, but it's actually in place to achieve something great, which is sharing sensitive data in a very efficient and secure manner. Right. And so it is actually a permissive law, not a barrier law. And that's one of the myths that we try to overcome immediately when talking with practices is, a lot of times HIPAA is treated as a 4-letter word rather than a 5-letter acronym. Right. And so it doesn't have to be like that. And ultimately, our platform is allowed for thousands of eye care practices to address HIPAA in a very easy and comfortable way. But when you look at, even in today's age with the coronavirus and when you think about sharing that data and how valuable that can be when you're talking about better treatment outcomes, right? Protocols that can be shared. It's something that's very important and can be a huge benefit and actually drive down costs to patients as well as practices. So it is very important. I'm sure we'll dive into the intricacies behind it, but yeah, absolutely. Now more than ever is extremely important.
So Matt, let's take it from the top, man. Like, who are you? How did you even get along with this company or join this company? Let's just break down who you are, the company that you're representing this evening, and let's just touch a little bit on your journey in eye care.
Yeah, no, it's been quite the journey. I was just talking with somebody the other day and I said, I've been in the eye care industry now for 12 years and that makes me feel old. I started in 2009 with an IT company based out of New York, and it was kind of a mom and pop shop, but we specialized and found a niche in the eye care industry. And so we first started with, installing EHR practice management softwares, the fat client versions on servers and computers and building networks. And, that kind of evolved into hosting and data backup and everything that IT is today, that managed service model. And so ultimately, with working with those practices all across the country, they started coming to us in about 2012 and asking about this security risk analysis, right? Okay. That was something that was a prerequisite or an objective for meaningful use, right? Or promoting interoperability, or now MIPS, right? It's evolved in itself, and it's changed a bunch of names over time. But as they were coming to us, our practices really didn't have any other place to go for this security risk analysis requirement. And as we looked into it as an organization, and at the time I was VP of sales, I saw an opportunity, right? An opportunity to not only service our customers with a big need and making sure that they're following those requirements and objectives for meaningful use, but then also a business opportunity on our side. And while, HIPAA compliance absolutely includes technology aspects, it's not just about technology. And so we were an IT company, but it still made sense for us to look into this, even though it goes kind of outside the boundaries of just technology. And so we started consulting. We would send out technicians on site to practices across the country, conduct the risk analysis, provide them their results, and they go on their way. Ultimately, as we started doing that, we looked into, what does it take to be HIPAA compliant in its entirety, right? What are the different things that are necessary to be HIPAA compliant beyond the risk analysis? Because that's really just the tip of the iceberg. And so it really evolved in itself to be a full-on HIPAA compliance consulting business, where we would take them beyond the risk analysis and consult with them on an ongoing basis, implement policies and procedures, train their staff, do the whole gamut, make sure they take care of their business associates. But ultimately, for us, it wasn't a scalable business model. It was higher cost to the practice, higher cost to us, right? There's a lot of manual labor involved. And so I had this God-given vision of, this could be something where we could automate it, right? This could be, in my mind, TurboTax for HIPAA, right? So why don't we just make it super easy to use, give the power back to the practice, allow for your average office manager, doctor, optician, technician, someone in billing who's not an expert to easily manage their compliance program and do it efficiently. And just answer some questions, fill in some profile information and get exactly what they need. And so unfortunately, it didn't work out with the IT company that I was with. And my now partner and I, as all great ideas do, they start in a garage. He had just had a baby, and my wife and I were over there. We were friends first. And he just starts picking my brain one night. And he's like, what is this idea that you have? What do you want to do? And we went back and forth, and, the conversation went from the garage into his home office, and he starts sketching out all this stuff. And he's like, man, I think I can help you out with this. And so the conversation, evolved just that night. And of course, one of those things, pie in the sky type thing. I woke up the next morning, he had probably sent me 20 emails about how we can get this done. And so it was great because, I had the industry expertise, HIPAA expertise. I knew what the product needed to be, but I didn't know how to execute. And he filled in all the gaps. He's perfect, right? So he had entrepreneurial experience, business experience, financial experience, development experience. And so we tossed around ideas for about a week. And after that, I went to the company that I was working for, and I just said, I cannot not do this. It'd be one of those things I would regret for the rest of my life. And so we jumped in both feet. I like to say I took about a 6-month vacation while he worked the whole time and getting it done. He spent a lot of late nights. I still got nice dark hair. He's now gray. But it worked out really well where we were able to build that TurboTax for HIPAA. So we jammed about 18 months of development into 6 months in 2016, from about June to December, and launched in December with the idea, if I can just feed my family, we're good. And so we're thinking, 75, 100 customers. Hey, man, we're rolling. This thing can work. We look up at the end of 2017. I think we had somewhere around 400 customers, and we're like, all right, this is legit. And not only that, but people loved using it, right? So really, the test case was, well, what happens upon renewal, right? Will they renew? Will they continue to use it after year one? And 1 month goes by, everybody renews, and just everybody continue to renew. And so now, we pride ourselves on a 92% renewal rate, right? I mean, that's something that's almost unheard of across, any industry, EHR platforms included. This is a nice to have, right? This is, hey, I need my EHR. It'd be nice to have Abyde, but people love using it. So we just haven't looked back from there. Right now we have about 17 or 1,800 practices across the country using it. We've branched outside of the eye care space. Obviously, I've made most of our headway in the eye care space because of my relationships that I had before starting Abyde. But it's everything we thought it was going to be and more. We feel like we have a great opportunity. I saw a lack of really two things when it came to HIPAA compliance for small independent practices, right? They hadn't been educated properly on what does it truly mean to be HIPAA compliant. And even when they were, there was no real easy to use solution, something that minimized efforts, not maximized, right? So we wanted to take something that was complex, confusing, overwhelming, and do the exact opposite. Make it easy to use, simple, right? Very approachable. And one less thing that a practice has to worry about so they can focus on patient care and building profitability. And so practices have really taken to it. The feedback we get is amazing. It's awesome to see. And so we're really excited about what the future holds for us.
Well, two things. Number one, congratulations on making HIPAA sexy, because I didn't know that was possible.
Yeah, it's not.
Number two, you got to tell us where the name came from. I mean, what was the reason behind that, or where did that derive from?
Yeah, no, it's, obviously Abyde, right? It makes sense. You have to abide by, these HIPAA compliance requirements, but, really it comes from, faith-based background. So it comes from the Bible. John 15:5, if you remain in me and I remain in you, you bear much fruit. And so Abyde is so much more than just a business. Abyde is about the people that we're going to impact, and we have impacted, right? So the people that we can impact that work for us and their families and helping them provide for their families, helping impact the community, right? And so we love to get out in the community. We've created an organization within Abyde. It's called Abyde Cares. So it's actually 3 C's, but creating community and cultural awareness requires everybody to serve. So we get out and serve in the community. We love to support our community, but also, making an impact and trying to bear some fruit, in the business world, while also, serving our customers as well.
Wow.
That's great.
Wow. Yeah. I knew there was something great about you, man. It was just good energy. When I saw you online, I was like, there's something about this guy.
I appreciate that. Yeah. And like I said before, all great companies have to do something a little bit different. So that's why we have the why rather than the I.
I like it.
Well, Matt, one thing when we were talking earlier, this whole idea kind of started from, all right, you guys, you got to be, if you're going to file for MIPS, if you're going to try to get these extra payments for Medicare, you got to do these certain steps. But for whether you're filing MIPS or not, like, how important is it in your office to have a HIPAA compliance officer and a protocol for all of this?
It's super important. I could run you down a list of enforcement actions, but, not necessarily here to scare anybody. I think what most practices should take away from HIPAA compliance is that we're all patients somewhere, right? And so when you're talking about securing this sensitive data that, medical practices have access to and actually store most of the time, they're doing the right thing by their patients when it comes to complying with HIPAA. And so, we look at HIPAA compliance kind of 2 different ways, right? There's the security perspective of making sure that information is secure, but then also protecting the practice as well from potential investigations. And so there are really 3 different ways that an investigation can occur for a practice. One of them is really unlikely, and that's a proactive audit. So, we hear it, I'm sure you guys see it on Odie's on Facebook, the HIPAA police, right? There's no such thing as the HIPAA police. They do have a full-blown audit program. It's lost a little bit of steam. So, you can be proactively audited, but more likely than that is a data breach, right? If you have a data breach, you are under obligation to report that. You even might have to report it to the media, depending on how many patients were affected. And so when that process kicks off, ultimately, you need to make sure as an organization, you can protect and mitigate your liability for that data breach. Nobody's immune to a data breach, right? I can go down the list of large organizations that spend millions of dollars a year that get hacked. And if smaller independent practices feel like they're not a target, they're wrong. That information that they're storing is 10 times more valuable on the black market, because you're talking about stolen identities, than any credit card information. And so that information needs to be handled with care. And ultimately, you know, if it is breached, then how do you prove that you were doing everything in your power to secure that information before it happened? And so the other side of HIPAA, when you're talking about a practice really trying to protect themselves, and our definition to medical practices for HIPAA compliance is documenting that there's a culture of compliance within the organization, right? You need to have proof through documentation that there's a culture of compliance within the organization. OCR is not going to come in and just investigate and ask some questions and walk away. There is specific documentation they're going to ask for. And so making sure that they have that documentation in place is vital. It can literally be the difference between continuing in practice and not, when you start to see some of the fines and the dollar amounts that are behind them.
Financially, I mean, what is an infraction going great, if you will?
It's quite a gray area, to be honest with you. It's really subjective, whatever they want to do. They do have different tiers. So in their eyes, you either are or are not HIPAA compliant. You either have all of the documentation they're asking for, or you don't. Obviously, when you cross that line on the wrong side, the fines substantially arise. But you can actually be fined even if you are HIPAA compliant, right? So if you have all the documentation in place, but you haven't implemented a solution to correct, you know, an area of vulnerability, then they're not going to just let you go. And so we've seen that the smallest fine has been $10,000. That was a dental practice last year. All they did was, according to the government, inappropriately respond to an online review and provide too much information in their response. So they got dinged $10,000. The largest we've seen is $16 million. That was Anthem. They're obviously a really large organization. You can be fined, per violation. So that's how it continues to compound on top of itself. But they do take into account the size of your organization, the severity of the breach or the violation. So, there is a little bit of common sense behind the way that they go about their enforcement actions. But, even at $10,000, who's got, especially now, who has $10,000 sitting on their desk they can write a check for without it being some type of, impacting the practice negatively. So it's all across the board. They just announced a couple over the last month. I believe one was in the tens of thousands. The other one was over $1 million. So it can really be all over the board.
Now, with COVID-19, I mean, it's two ways to look at it, right? There's all types of information flying all over the place with telehealth, telemedicine. And we know that, things have been dialed back a little bit when it comes to telehealth, telemedicine. But with HIPAA, are they dialing back, being that we're in this weird climate, or are they actually being more aggressive because they're like, okay, there's more information floating out there and there's more vulnerability to these practices or places that they need to just, be a little more aggressive? I mean, what are we seeing more of? Are they falling back, or are they being more aggressive?
So the trend has been, just over the last couple of years, way more aggressive, right? So 73% of all of the financial settlements that the government has levied has been in the last 40 years. And they've been levying settlements now for 12 years. So that's a third of the time, 73% though, of all those enforcement actions has happened. With HIPAA, most of the things with the government, they lag behind a bit, right? So the things and the events that are going on right now, only time will tell. What I can say, right, because investigations are typically occurring a year afterwards, or at least, finalizing a year afterwards or more. But what I can say is our organization has received, I couldn't even put a number, maybe 50 times the amount of patient complaint calls, thinking that we're the company that you need to call, like we're the Office for Civil Rights.
Oh my gosh.
And so our support team has probably fielded more patient complaint calls over the last 4 months than we have like support calls from our customers.
Oh my
It's
God.
incredible. We get them all the time through our website. And so, you know, our team politely, you know, just pushes them in the right direction and lets them know this is, but just crazy stories. I mean, people are all up in arms about it. You know, you talk about the mask mandate and people are using HIPAA as an excuse, which the two don't go together.
Right.
So it goes out there, HIPAA, there is nothing there. But, you know, I believe this is the tipping point, right? I mean, the fact that we're having this conversation right now, I always knew, you know, 2011, 2012, you know, HIPAA was not in the limelight, but I knew there was going to be something that caused this tipping point that brought it to the forefront. And, you know, when this started happening, and we were able to kind of, you know, gather ourselves after the first few weeks, it was like, I think this is it. I think this is going to be the catalyst for a renewed focus coming from the government when it comes to HIPAA because of all the sensitive data that's being shared. You got Ezekiel Elliott, right? I'm a big football fan. His COVID diagnosis got released. He didn't like it. He actually tweeted the word, and he spelled it correctly. Good for him, right? The acronym HIPAA. Question mark, when that diagnosis came out. He's going through a lawsuit right now. Right, you just can't get away with sharing or leaving this sensitive information vulnerable without trying to do everything in your power, right, and keeping it secure. So it has gained, you know, obviously we stay up to date with like Google alerts and all the information that's coming out with HIPAA. I've almost, you know, every article that's written about any sporting event, any, you know, team always brings up HIPAA. You're just hearing HIPAA over and over and over again, data privacy, patient privacy. So this is something that I think we will see on the back end, maybe next year, the year after, some of the results of what's going on right now with this kind of messy middle that we're in terms of securing that sensitive data.
Now, you touched on something earlier with the football player, and that was a question I was going to ask. There's one thing to get a fine, but the patients can also sue you as well on top of whatever fine that you may have?
There's some gray area there, but yeah, there's the Office for Civil Rights has been kicking around some ideas, allowing for almost a disbursement of funds to those that have been affected. But yeah, you know, liability can be held by the provider or by the person that caused the breach. So, you know, it is something that can be multifaceted, unfortunately, for those who are at fault.
Let's talk a little bit, because I will applaud you guys. Earlier in the show, I mentioned the private practice that I'm at. We use Abyde for our HIPAA compliance training. And very quickly, you guys came out with a COVID-19 specific training module that I remember taking. And, you know, it mentioned on there, okay, if a patient does have a positive test, like that is something to other government agencies that are doing case tracking. Like that's information that HIPAA says we should share. So it's not like if someone is COVID-19 in your office, you're not allowed to tell anyone. But of course, you can't tell the patients in the waiting room, you know, who it was. So but I think that's why it gets so confusing, because if you don't have this training in place, many doctors are going to be like, so I'm allowed to tell this entity, but not this entity, but not this entity. And COVID creates a big storm for them.
It does. Providers need to understand that there are 3 different reasons that they can share information without any type of patient authorization. And so that's for treatment purposes, right? So from doctor to doctor, if you were treating the same patient, there's no reason to get an authorization form signed or consent form signed for that. For payment purposes, right? So sharing it with a health insurance company or even a third-party billing company, so long as you get some additional paperwork in place for that, like a business associate agreement. And then operations, right? Practice operations. So within the duty of the practice operations, if you have to share some type of information, you can. But overarching all of that is going to be the minimum information necessary requirement. So in all communication and all disclosures, regardless of whether it's permitted or whether it's permitted, we don't want to do it if it's not. But if it is permitted, always only provide the minimum information necessary to get the job done, right? Whatever that may be. So for treatment, payment, whatever, you don't have to share social security numbers. We're not sharing that, right? If we have to share 8 years of medical history, we're not doing that, or different diagnoses. You don't necessarily have to do that. So that's something that you always want to take, into account is, even when you do share that information, always share that minimum information necessary. And so for your example, Dr. Lyerly, let's say, you have a COVID patient, you find out, a week later, you can call the patients that you knew they came into contact with maybe in the waiting room, but do you have to share their name? Absolutely not, right? You don't even have to share the sex. Just that, you feel like they may have come into contact at the time and they need to be aware, and that's fine. There's no problem with that at all.
I want to circle back, and this kind of ties in with COVID-19 because we're seeing more people probably give reviews and stuff of their experience going in, whether it was great or not so great. Are you seeing an uptick? Because I know you guys are getting a lot of the calls that are supposed to go somewhere else, but are you seeing an uptick in regards to just too much information given with reviews online? Because I didn't even think about that piece.
Without a doubt, that's probably one of the biggest areas of concern especially for independent practices, right? A hospital is not going to be, responding to a review more than likely online. But yeah, when you talk about impermissible uses and disclosures, that's probably one of the main areas that they do that, is responding to reviews. It is. And I get it, right? I'm a business owner. So, you're a doctor, you're a business owner, you built your business, and it only takes one bad review, right? To potentially bring you down. And you want to respond, you want to defend yourself. But according to the OCR, in so many words, you want to make sure that you don't even address them as a patient, right? You don't even want the public to know that they saw you as a provider. And I know that's crazy to think in the eye care space, right? Well, what does it matter? But how does the government differentiate first what somebody feels like is sensitive information, right? Another person may not. And so sensitive data, PHI, there's 18 different identifiers for that sensitive data. And so you want to take that into account. And in addition to that, you want to make sure that, the patients, if you're a psychiatrist, right, and you're not in the eye care space, right, that's where things really start to get, a lot more sensitive. And so they can't draw a line, okay, eye care practices, you can respond to patient reviews. Psychiatrists, you cannot, right? So they have to draw a hard line there. And again, what sensitive information or what somebody wants one person to know may not be what, the other person wants somebody else to know.
Yeah. I know Jen and I, we teach courses across the United States on social media, and we talk about online reviews. And I know one thing that Jen always brings up is taking that conversation offline and doing it behind closed doors or picking up the phone to have that conversation. And after hearing everything you're stating right now, I think everyone should always take every conversation offline, because I never even put thought into, not even addressing that person as a patient, because, as an eye care professional, they are a patient or they're a consumer or a customer, whether in the retail aspect or the optical outlet. But, that's something that needs to be a full-time job for someone that's in the practice, because you can really get screwed over if you really think about this. I mean, this is crazy, isn't it, Jen?
Yeah, no, I mean, that's where this move the conversation offline kind of thought came from, that I've been kind of espousing for many years. So like you said, like when you read the information, Matt, like you cannot even admit that they came into your office or were ever even seen at your practice. So there's nothing you can say in a review that is going to help. It's only going to hurt, except for, we're so sorry for your experience. Please contact us at
That's it. Yeah, just a generic response. We appreciate your comment. Please reach out to our office to discuss further.
Yeah. And the crazy part is, when you put a response like that, the person on the other end is like, they don't really care about me. They gave me this generic robot answer. But in reality, it's like you're looking out for your practice so you don't get fined. And that fine is going to be greater than losing that patient. Right. So it's like one of those things where it's kind of like a catch-22, because you don't want to look bad online in front of everyone, but at the same time, you don't want to get fined. And now just thinking about this, my mind is starting to just run 100 miles per hour. I'm scared for private practices, because this is the last thing that's on a lot of private practices' mind. I work for my eye doctor, and I always tell people we're like a private practice on steroids. So we have someone that can deal with this 100% of the time.
Right.
But when you have someone that runs a practice, that's the accountant for the practice, that's the janitor for the practice, that's the buyer for the practice, and that's the doctor for the practice, I mean, I guess that's where your company comes into play. So if you don't mind just really breaking down the nuts and bolts of your company, I mean, like, what do we get if we sign up for Abyde today to make our life easier?
Yeah, it's a great question. You're absolutely right. It's why we developed Abyde, right? So for the person in the practice wearing 10 different hats to easily manage their compliance program, we like to call it, in so many words, TurboTax for HIPAA. Right? You don't have to be an expert. You fill in some profile information and we dynamically generate all the documentation you need to prove that you are compliant. But we do it in a very easy to understand fashion, very much a methodical process. HIPAA compliance is never just a box you check and you're done. I think that's a misconception that's out there as well. And so it's an ongoing process that's always got to be attended to. So with Abyde, what we love to do first is we love to educate. Again, our solution is great, but if you don't understand your roles and responsibilities when it comes to HIPAA, then really our solution doesn't mean a whole lot or carry a whole lot of value. And so we love to educate first. So our team does a lot of education where we give roles and responsibilities, to practices, office managers, and doctors. What's going on in the industry. Very much this conversation that we're having right now, just giving a little insight as to what's going on with HIPAA compliance. You really don't hear about a whole lot. Nobody's telling their war stories about how they've been audited. So we start with education, and then it's very much a white glove type service. So we like to say we're consultants with a really cool software, which means at any time when you're using Abyde, you pick up the phone, you call our team of experts, and we answer those unique questions that they may have that come up on a daily basis. Whether it's, who can I disclose information to, or how do I do it securely, or who do you recommend to do X, Y, and Z? Those are the conversations that we're having on a daily basis. But when it comes to the software, it really takes care of 90% of all HIPAA compliance issues, and any questions that they might have, especially through the training. So it's a full suite HIPAA compliance program that is as automated as you could possibly get, which means for the practice, it minimizes the time that they're spending on HIPAA, but also gives them peace of mind that they have what they need when they need it. And so we take them through a risk analysis. It's one of the first main objectives for HIPAA compliance. It sets the baseline for their compliance program. We identify risks and vulnerabilities within their organization. Many of these things that we're talking about, right? Technical, physical, administrative safeguards that most eye care practices, doctors, office managers have never even thought of. Right. And so how hard is it to do a risk analysis as an office manager or a doctor if you're not an expert? Right. If you're trying to identify vulnerabilities, if you had a vulnerability, you would have already implemented a solution. Right. And so it's like, well, wait a second, I need an expert in this. And so that's where our risk analysis is so valuable. Not only is it very easy to answer, that the questions are not geared towards an IT professional or a law professional or a HIPAA expert. It's geared for the office manager, right? Again, like TurboTax. Did you get married today? Oh, I can answer that one, right? Those questions, those are the very easy. We've simplified the audit protocol, but we've done it not for enterprise level, organizations, your hospitals, but what does an independent practice need to worry about? What are those vulnerabilities? Because those are going to be different than a large organization, right? And they even have CIOs and CTOs and full-time compliance teams. So, we take them through that risk analysis. We help them identify risk. We help them mitigate risk. So not only do we identify, hey, you're responding to patient reviews. You maybe don't want to do that going forward, but here's a sample review of what we recommend, right? So we help them mitigate their risks through all three categories of safeguards. And then from there, it's very much an ongoing process where they're going to get training videos. The training videos, as Dr. Lyerly said, I love the feedback because we hope that they're entertaining. Again, HIPAA is not a fun and exciting topic. You probably have your, the lowest amount of viewers on this one. But, we try to give them, again, the pertinent information that they need. What does an eye care practice need to make sure that they know when it comes to HIPAA? Because it's totally different when you're in the hospital level. So those videos is a very automated process. It gets sent out automatically to all team members. They go through it on their own time. They can watch it on the bus. They can, watch it on the train. They can, do it while they're sitting at home in their bed, before they go to sleep at night. It's 15 minutes. Immediately they're asked to take a quiz. We record all of that information and then provide each employee with a certificate of completion as well. So, just minimizing the process. The office manager or the doctor doesn't need to understand or know when training needs to happen. We'll ping you. We'll let you know, right? And really the backbone, is actually a great time for me to mention it. The backbone of our software is our notification system, right? And so we tell the practice what to do and when to do it. And so it can be out of sight, out of mind. We send them a notification via an email. It outlines an objective. Then they have like a little notification bell, just like Facebook or LinkedIn, any social media application that you use that outlines that objective. And then the objectives are typically very simple to complete. You're either answering questions or updating information. And so one of the areas of real concern for practices when you're talking about documentation is making sure that you have all of your policies and procedures documented, and not only documented, but specific to your organization. I could draw the similarities from taxes to HIPAA all day, but a really good one is, if you're in an IRS audit, you can't just have generic receipts or generic documentation. And so we see a lot of practices out there that just go and download or purchase templates online. Maybe they fill it out once, maybe they don't. But if they do, they don't update it. They don't keep it current. They don't keep it accurate. And so through a series of ongoing compliance questions that we send out once a month, we're able to keep their policies and procedures as accurate as possible. And so they're dynamically changing. There's nothing the practice has to do to draft or edit those, but they're dynamically changing as the answers change. So it's great, right? As solutions are implemented, their policies will change as they make those changes in Abyde. Maybe an employee leaves and they take the employee off of their profile. That employee comes out of all of the policies and procedures that they may have been in on. And not only that, one thing when you're drafting policies and procedures for a practice, you have to take into account state HIPAA laws, right? So federal HIPAA laws is confusing. State laws can override federal laws. So when it comes to data breach notification or patient right of access laws, right? What is the time frame that you have to notify patients if there's a data breach? Or what is the time frame you have to comply with a patient request to receive their information? All of those change state to state, and it's crazy. So it's nearly impossible for practices to do it on their own. Our team does a great job of staying on top of those laws. And right now we have over 40 different dynamically generated documents that they can use for their HIPAA compliance program. So a full A to Z HIPAA compliance suite that just simplifies the whole process and allows the practice to get back to doing what they do best.
Now, I want to number one jump into cost, because I think we definitely should cover that. And I know it's probably all over the place because there's different size practices, hospital settings, you name it. But we had a question from Dr. Janelle on LinkedIn, and this is going back to prior to you breaking down the services that you provide with reviews. If the patient puts their information out there first, are we then allowed to convey a different type of message, or is it still keep it generic? Don't even say that they're a patient, and just like we said before, get them offline, which I know she does, but if someone puts their information, what kind of dialogue can you really have? It's
actually a really good question. I get it a lot, right? So I'll give you two answers. I'll give you the legal answer, and then I'll give you our recommendation. The legal answer is yes. Once they put their protected health information out there, it is considered consent. But that being said, I would not recommend even venturing down that road, right? You just don't even want to have to defend yourself. if they blow the whistle on you. So that is the case once they put it out there. It's much like email, right? You can, if a patient emails you unencrypted and they send their information, you can email them back legally, according to the OCR, but we would never recommend that. It's just one of those areas you don't even want to venture down if you don't have to.
Gotcha.
That's fascinating. Actually, honestly, if a patient posted a bunch of personal, private information on our office social media account, for example, I'd almost be scared that, like, just by it being on our social media, that we would be breaking HIPAA with what a patient posted. So my gut instinct would be like, delete. Let me just call this person.
Exactly. Delete.
Yeah. But let's talk about the money, man. I mean, like, this is an amazing service. I don't own a private practice, but if I did, definitely I would subscribe and want to sign up, because I don't want to deal with any of this. I want to see patients and generate as much money as I can and help as many people as I can and take care of my family. But let's just, give a range or what we're working with or how it works, or if it's a subscription service.
It is.
Break it down.
Yeah, absolutely. It's a subscription service, software as a service. It's a 12-month agreement. You can either pay up front. If you pay up front, we give you a little discount, a 10% discount. You can pay monthly as well. We break down pricing it's a matrix, really, is what it is. So it's based on number of locations, because each location needs a risk analysis. And even though it may be the same organization, physical, technical, even sometimes administrative safeguards can differ. We get pushback on that a lot. We had a multi-location practice get audited because of a theft of a laptop. The theft only occurred in one location. They asked for risk analyses from multiple locations. So, it's one of those things we let them know. You do what you want to do with that. But we've been down that road, and you need to have specific documentation for each location. So that's one of the parameters. The other parameter is number of employees for training purposes. So we went out and we did market research trying to figure out, what is the average cost for someone that just want to get a risk analysis done? What's the average cost for training per employee? Put those two together, and we went below. We wanted to make this a no-brainer. So the average cost to most practices out there, we see one location, 6 to 10 employees, is somewhere around $1,200, $100 a month. Typically. So, you want to say like $3.15, 20 cents a day to really, guarantee, as long as you follow the notifications and do as we ask you to do, guarantee you don't have to worry about this, and you have the documentation you need when you need it. I'm a Starbucks guy. I go to Starbucks all the time. The nitro brews got me hooked. Those things are $5.50. And I can go every day if I wanted to stay awake for a week. But $5.50 for the nitro brew, and then you look at the value that we're providing behind Abyde, and not only the time savings, because this has to get done. It's a federal law, one way or another you have to do it. But then what are the potential penalties behind non-compliance or thinking you're doing it correctly and you're not? There are a lot of companies out there that only provide a few pieces to the puzzle, right, and not a comprehensive compliance program. So we feel like we're extremely competitive with the pricing. It's on the lower end of the market, so to speak. You get what you pay for most things in life. But when it comes to Abyde, we wanted practices to be educated first, understand what the responsibilities are, see the need to be compliant, then see our solution, see how easy it was, and say, I need this. And then when they saw the pricing, to go, you know what, this is a no-brainer. And really, my partner and I literally used those words, no-brainer. We want this to be a no-brainer for them. You would not be, or you would be completely surprised with the amount of times we go through that whole process: education, show our solution, show pricing. The office manager or the doctor goes, oh my gosh, this is a no-brainer. Right. Because it just makes all the sense in the world. So it's really cool that it's worked out that way. But yeah, typically $1,200, $100 a month, call it, right? $100 a month for the average size practice.
Yeah. Well, I mean, the best way to present it is just say, hey, if you get pinged with a fine, that's $10,000 at the minimum. And, we're going to help you avoid that. And even after 10 years, you're a little over 10,000. So, I mean, that's pretty straightforward. Like you said, it's a no-brainer. Maybe that should be a new tagline.
I said, emphasis over HIPAA again, ... It's a no-brainer. I like it.
Well, Matt, thank you so much for your time this evening. Obviously, as people are doing this and getting into the weeds a little bit, they're probably going to have more questions and hopefully want to seek you out for help since you have such a great system in place. So could you share some of the information so they can learn more about your company?
Yeah, absolutely. And before I do, I just want to add in there when it comes to pricing. I talked to our team and we put together a special promo code for Defocus listeners. It's Defocus20, right? So you can go ahead and take your $100 a month, reduce it by 20%. So the average cost will be $80 a month for your Defocus, media listeners. And so again, that's Defocus20. You can go right now on our website, and our pricing is actually very transparent. It's on our website. So you can go, check it out and look at the matrix for your organization. And then when you go to sign up, there'll be an area for a promo code. You just put that in, and within a minute, you're good to go. But our website is abyde.com, really easy. That's abyde.com. Info@abyde.com is an easy way to get in touch with us. Our phone number is 1-800-594-0883. Feel free to email me. I have no problem, answering any questions. I mean, we want to be a resource, right? Obviously, we have a really good solution, but we want those out there to see value in us as a resource. And so we love answering questions for non-customers, right? Because we know at some point they'll come around. They'll get it. They'll understand they can't do it on their own for any less expense or any quicker than using Abyde. So, if there are those out there that have questions, please pick up the phone, give us a call. And understand that we're not going to try to beat you over the head with the software package. We're going to cater to your needs, answer your questions first, and then maybe get you on board with Abyde.
I love it, Matt. Thank you dearly for hanging out with us this evening. You really opened up my eyes, and I'm pretty sure all of our private practice friends are really intrigued by this software that you guys have, this program that you have, the subscription service that you have, this technology that you have. And I hope they take full advantage of it. And again, thank you so much. And we look forward to learning more. We should probably make this more of an annual event because things change on a regular basis. So we would love to get you back.
Maybe a HIPAA update.
Yeah.
It's changing on a weekly, monthly basis right now. So absolutely, anything that y'all need, I'd be happy to help.
Awesome. All right. Well, thanks for hanging out with us. You guys have a great one. Until next time.
Awesome.
All right, colleagues, and it's a wrap. Thank you dearly for hanging out with the Defocus Media team. We hope truly something resonated with you. And if it did, be sure to give us 5 stars and make sure you follow us on all social media platforms: Facebook, Instagram, Twitter, LinkedIn, you named it. And our handle is at Defocus Media on all platforms. And until next time, be sure to keep it 2020, and we look forward to seeing you on the next episode.